Facilities that make this program possible are provided by the City of Highland Park. Programs are produced independently by members of the community. The City of Highland Park is not affiliated with the following program or the producers of public access programming and is not responsible for the content. The following program does not reflect the opinions of the City of Highland Park.
Welcome to Chill Out. I'm Pam Chill. I'm one of the Highland Park senior producers, and I'm very fortunate to have as my guest today Dr. Mark Frederic talking about the treatment of back pain and chiropractic.
Yes.
Yes. Welcome. Thank you so
much.
I've been trying to get you on my program for years.
Yes.
Alrighty. So tell me a little bit about what parts of the body when you do chiropractic adjustment that you are working on.
Well, we work on the whole spine. Even though a person has low back pain, they could have a problem. Actually, we work on the whole body. They could have foot problems, they could have knee problems, they could have hip problems. Any of those things from the foundation up can be a cause of low back pain. And when you have low back pain, other things can happen in the spine also. You could have problems in the mid-back and the cervical spine.
Okay. Now we have an assortment here of, now are these real or the?
No, these are plastic models.
Plastic models, okay.
Yes.
So if you can explain what we have here and give us a little bit of idea about the spine, the spinal column.
So the spinal column is basically made up of about 30-some different bones. And what I do is, as a chiropractor, I diagnose and treat spinal mechanical pain. And what doctors of medicine do is they treat the infection, the tumors, and also fractures of the spine. I treat everything else. And that's about 90% of all back pain is spinal mechanical pain. Now what I try to decipher is, with my examination and with x-rays, how healthy the spine is and what the biomechanics of the spine are. And we do that by doing an examination of cervical, thoracic, and lumbar examination, along with a neurological, chiropractic, and general examination of this person. And as we do that, we can find out where these biomechanical dysfunctions are in the spine. Now with these here, this is like a normal, this is a normal spinal unit. You have a healthy disc here, right here, with a good nucleus pulposus and good annual fibers here. We have a lot of space where the nerves come out of the intervertebral foramen right here. And what we try to do is see, as chiropractors, if there's any subluxations or vertebrae that could be misaligned, causing a pinched nerve here. Now, as the vertebrae start to degenerate due to either trauma, stress, or any type of other injury, repetitive motion also, you could get these tears in the annual fibers that can cause later on disc problems or disc herniations, disc bulges, okay, which can cause pressure on the nerve. I don't know if you guys see that or not.
And what would be some of the causes to that?
First of all, it's trauma. You could have
injury, accident.
Repetitive motion. People that are doing like using headphones all the time, phones, grocery store people that are in the grocery store, the people that lift and bend all the time, sitting all the time, anything that's repetitive, in nature, can cause over time tears and traumas of the ligaments, the tissues, and also the discs.
Now, when do you think someone should feel pain relief? How many adjustments would it take?
That differs for everybody. Okay, so if a person comes in with a trauma such as an auto accident, it takes anywhere from 2 weeks to several months. A person that comes with a sprain strain, I should say, a person that comes in with an accident that has a disc problem can take anywhere from a couple of weeks to many months. But a sprain strain of the muscles takes only a few days.
Alrighty. And on that, what happens to your body when it does get adjusted?
Well, basically what a chiropractor does is we're the only licensed physician that are trained to mobilize the joints, to actually make an adjustment, a cavitation, a type of therapy that actually helps the joints to move properly again. So basically what happens is that what we do is we use a small force, a very focused force on these joints, whether it be from in the top of the head all the way to the bottom of the spine, in a certain angle, certain vector, in which we can then mobilize a immobile joint. And by doing that, we help to create health in the area and also decrease any inflammation in the area.
Okay. Going back to doing the adjustment, there are a lot of masseurs out there and, a lot of therapeutic massages.
Yes.
Now, how does chiropractic adjustment differ from a massage, or is it also done with massage techniques?
Well, basically, at my office, I have a licensed massage therapist, and it works. Chiropractic works well hand in hand with massage and what we do. So massage basically helps to relieve muscle spasms, helps to increase the blood flow in the area. Chiropractor, basically, the main focus of chiropractic is to mobilize an immobile joint. All the research in the last 5 years has stated that if you should correct the joint first and then go on to working with the muscles, balancing out muscles, and also then strengthening muscles. Because if you have a joint that doesn't work right, when you start exercising that joint, you cause more injury.
What typically happens during the adjustment? If you want to just take me through, is it a half hour? Is it an hour?
Typical adjustments anywhere from 5 to 10 minutes.
Oh, okay.
Because basically, the adjustment itself only takes seconds. But in order to palpate the spine, balance out the muscles, I do also things such as active release technique, which help to balance out any adhesions in the muscles, help to balance out the muscles themselves. Excuse me. And then in that case, it helps to make the adjustments a lot easier. So sometimes it takes over 5 to 10 minutes to go through the whole process of getting the muscles loosened up and then making the adjustment.
Okay. During the adjustment, what if somebody's very apprehensive? If you're stiff, how do you do that then?
Well, basically, if it's
the first time, obviously
yes.
They don't know what to expect.
Basically,
right.
The first time people, like I said, if you have a disc problem, a problem that you have a disc bulge, disc herniation, and we call it a hot disc, and they're in so much pain that they can't move, then we have to do different types of therapies such as high volt, low volt. We have laser therapy, so we have to cool the muscle area down, the muscles in the joints down. So if you can't adjust people, a lot of times we have people that have been in acute problems, like they
lifted something maybe too heavy.
They lifted something up too heavy,
right,
or they've been sitting too much, or whatever. In that case, they can't even hardly move, and that we have to first of all decrease the inflammation in the area. Now, the other part of chiropractic is holistic care. And so what we also work on is we try to explain and educate people on how to have a healthier lifestyle. Because if you eat we just had this big holiday, and we had all sorts of different types of pies and cakes and candies and cookies
and dips and
truffles yes,
and, right.
oh my gosh, chocolates, and they're all good, tasting.
They're all tasty, but they're not really beneficial for your life.
And so what happens is that when you start to over time, eat all these foods that are not really good for you, then what happens is that you cause an internal inflammation in the body, and when you do that, a simple sprain strain can turn into a very long aggravation in this body, because your body turns into an inflammatory factory. And when that happens, then you're in trouble. So if you have a small sprain strain, or you sit too long, whatever, then in that case you start getting these more and more inflammation in the body, which then causes more and more pain. So basically, we also consult people on how to eat properly, because it's very important to the overall health of a person. See, chiropractic is a holistic healthcare system, and I'm a doctor. Doctor should educate their patients on different things. Absolutely. And so basically, what we do at the office is we educate them on how to do proper exercise, how to do home exercise, how to eat properly. Okay, because if they do that, they'll be overall healthier and have less inflammation.
Now, when wouldn't you see a chiropractor? Can you see a chiropractor if you're pregnant, or pregnant woman?
My wife and I had 5 kids,
Uh-huh.
and she got adjusted for the whole term. In fact, a couple times she was the night before she gave birth to my
Because
children.
it really, the pregnancy itself, throws your whole body, your whole spinal column is, everything is leaning
yes.
forward, right?
Basically, what happens when you increase when you have a baby or you gain weight, the same thing happens. It causes more stress on the back joints and the muscles, the back joints and the muscles of the back. And so by, again, adjusting those, and over time what happens is that those joints become flared up, they become tight sometimes, and by adjusting the joints to help to loosen up those joints that are tight and balance out the muscles that are tight, you strengthen muscles that are loose and stretch out the muscles that are tight. And by that you help to reestablish a normal biomechanics of the spine. And that's a whole adjunct of what chiropractic does, is we help to, from the base of the feet to the knees, the hips, and ultimately the back, and throughout the whole spine, is then repair and correct any of the joints that have dysfunctions.
Okay. I did want to ask you, when would somebody, again, not see a chiropractor?
Well, again, like I said,
Different ailments, or if they've had back surgery, would they still be a good candidate?
I've treated many post-surgical cases that have been fused or had other types of surgery on the backs. But the main thing is, like, if they have cancer, if they have fractures, infections, tumors, all those things, I refer out to the doctors, the main doctors that treat that type of injuries and diseases. But basically, what we try and do is treat people that, again, have biomechanical dysfunctions. If they have fractures, I refer out. If they have infections, I refer out. If they have any high blood pressure, we find some people that don't go to doctors. We do blood pressures and all those types of treatment. Of examinations.
Now, if you're no longer in pain, should you still see the chiropractor?
Well, we have a lot of people that do, because what happens is that they find out how well they feel, and they want to stay that way. See, we're a biomechanical machine, basically. And if you keep doing the same thing over and over, if you have a job, you have to keep doing the same thing over and over again, over time, those types of biomechanics start to become dysfunctional, because you're doing the same muscle gets tight, the same muscle gets weakened or whatever, and over time what happens is those joints and muscles start to cause inflammation and irritation. So it's not that they have to come in, it's that they find out that, well, I feel this good if I come in like every 3 weeks or every month or every 2 months. Everybody has their own length of time that they find out that this is the best for them.
Now, if they have, going back to, like, if they have a traumatic injury or a car accident or, lifting something too heavy, then they might need adjustments more often initially.
Yes, because that type of injury starts the degenerative process. The degenerative process, in actuality, you have a healthy disc, which is, I'm not sure you can get that on camera, but a healthy disc right here is a huge amount of difference between this unhealthy disc here, which is degenerated. And as time goes by, and you go from healthy to a degenerative disc, the degenerative disc has more nerve innervation to the unhealthy disc, which causes more pain. So over time, when you get an injury that goes from healthy disc to an unhealthy disc, that unhealthy disc has more innervation of the nervous system, which causes you more pain, and that will have you'll need more therapy on a situation like that as time goes by.
Absolutely. Now, if you can't handle their pain, what is the next course of treatment?
Well, what we do is when people are in pain, basically there's pain management. There's, you can send them to pain management. You send them to, people can't, sometimes you send them right straight to the emergency room, if they just can't even move at all. So there's pain meds, there's anti-inflammatories, muscle relaxers, there's injections, there's trigger point injections, there's epidural injections.
But they may just need it initially, and then, once they've started the treatment and it's working, then...
Well, a lot of times we work in conjunction with medical doctors for, like, they'll give them medication, we'll do the adjustments, we'll put them on some type of home exercise program. Then if they're in some really bad cases where you have disc bulges, herniations, or protrusions, they might need pain management, where they get injections, and with that you get cooled down the disc to a place where the person can then start to do some of this physical therapy adjustments and muscle strengthening
right,
therapies.
but at least it lets you do your job.
Yes.
So that's what's imperative, right? Now, can chiropractic adjustments relieve any other types of illnesses as well?
Yes.
And if so, what would they be?
Well, all you have to do is follow the nerves. If you have the nerves from the spine, neck, all the way down to the lower back, those nerves go to all areas of the body. They go to the liver, they go to the lungs, they go to the heart, they go to the stomach, the indigestion, stomach, large intestines. And so what happens is that if you just follow the nerves, take a Gray's Anatomy book and see where those nerves go to, you can find out what exactly those nerves control. And so basically, if you have a stomach disorder or a intestinal disorder or a problem in the large intestine, a lot of times if you help with the correction of those nerves, they'll also help other things that you're doing. If you're going to a medical doctor and you're getting medication for things in the area, by getting adjustments in, like let's say you have colon problems, constipation, diarrhea, a lot of times by adjusting those lower vertebrae in the spine, it can help to increase the health of the area as you're along with the therapy and the medication that you're going to getting with the medical doctor.
Now, do you recommend any type of vitamins or supplements to maintain and promote bone health?
Well, not only bone health, again, you have to look at it as a holistic approach. And so basically what we do is we take blood work, like if you can go to your medical doctor, they can get blood work, they can bring it back to us, we can analyze it. We can also do...
you do x-rays too?
We do x-rays.
We just get a baseline, you know, if something is...
In order for me to adjust some of the more serious things, we take x-rays and conditions. And so basically we do some front and side views of the spine. And also in some severe accidents, we want to find out if there are trauma to the ligaments and trauma to the discs. And so what we have to do is we have to also refer out to get MRIs. And MRIs then we can then see if there's disc problems, if they're herniated, if they're protruded. But also the only thing that can really find out if you have ligamentous trauma is flexion and extension views, side views of the neck and low back, because that way then we can digitize them and put them through computerized programs and then find out the exact range of motion in those ligaments. And if they are above and beyond the AMA guidelines, then we can say you have a trauma to the ligaments of that area, which then we can then relate to how long it's going to take you to heal, and also there could be a whole body impairment at that time.
Okay, what is up and coming on chiropractic? I mean, I'm sure you've been practicing, by the way, 34 years.
Yes.
You know, your practice is in Gurney. And I wanted to know just, you go to the conventions and what's new? Because you hear about all these spinal different surgeries and like minimal invasive surgeries for the spine. So what's new in the chiropractic field?
Well, I think what's new in the chiropractic field is, again, it's going back when I started, that it's holistic. When I was in school, I remember this one of my professors who had just started. He retired. He was around Denver, Colorado. He practiced in the mountains in that area, and he was 30-some years. So he started practicing in the 30s. And he came to all these, we were in the last tries at the time. And he said, the biggest thing that I want you guys to understand is that you're a holistic doctor. And that you have to treat the spine as a whole. And that, for whatever reason, that stuck with me. And now, some 30 years after he learned that 30 years, so 60 years that he understood that, the research in all the medical journals are saying the same thing. They're saying you have to treat the spine as a whole. Now, right now, I think most people out there know that the whole thing about opiate pain relievers, that this past month, in fact, I just was listening to the radio, they said that the average age is now decreasing because of opiate pain relievers. And so now, then the reason is because there is no People get addicted to these things, and what happens is that because of the pain. So now what they're
It's
finding,
unmanageable. They
right?
just, right.
And so what now?
And it takes very quick for them to be addicted.
I
you know,
understand
right?
that,
Very
sure.
quick.
And
Yes,
so what
in
happens?
1 week they can
yes,
become addicted.
yes, that's terrible. And so what the research is saying is that you have to now treat the spine as a whole, and that's what chiropractors that have started years ago, before I started, were saying, that were teaching us. Now the research is proving that. So I think the big thing in chiropractic, it's again this cyclical thing that it's now to the forefront in all the journals, all the research journals. So that what's going to happen is chiropractic is going to become, it has to, in spine pain, spine management, it has to become the center of focus of treating the joints, getting the joints working properly, and then balancing out the muscles.
Absolutely.
And that's what we're trained in. We've been training for years about that. That's our main. That's our main.
Just out of curiosity, how much schooling do you have to get your degree for chiropractic?
Well, I was 4 years at Millikan University in Decatur, Illinois, as an undergrad, and then I spent 5 years, 10 semesters, I should say, at the National College of Chiropractic. And I think that hasn't changed too much since I graduated.
So it is about the same. Okay, very good. Now, how does it improve neuropathy and balance disorders? Because chiropractic adjustments are just going out into different things other than just bones and spinal problems.
So with our neuropathy program, what we basically do is we found is that what you have to do, we have to again look at the spine, look at all the nerves that go to the feet, which are in the lower spine, but also we found, and I've found over the last couple of years, I used to do blood work and then I used to give them nutrients to people. But I found it didn't work that well. And what I finally found out was that you have to detoxify the person first. You have to detoxify the kidney, the liver, and small and large intestine. And once you start doing that, a lot of things happen. The blood work on its own starts to become more balanced. Cholesterol goes down, high blood pressure goes down, things like that. But it all starts with eating. You've got to eat right. We're poisoning ourselves with how we eat. And so basically what happens, I mean, and I'm just guilty. I load up on sugar last night. You got the pies, the cookies, all that stuff. It's just sugar is very addictive, and it's also bad for you. And then you have all the preservatives, all the nitrites, all the colorings, all that stuff. That has to be processed by the liver and the kidney and small large intestine. And so basically, when you start to detoxify, you get on a more of a rigid diet, and you give them nutrients that help to detoxify these certain organs, and from there, people just start getting better because the body wants to heal itself.
Absolutely. How do you find cold weather? Because right now it's bitter cold today. As we are taping, I think it's like -3 degrees with a wind chill factor of about -20, and I'm noticing it's that I'm stiff. I mean, like extremely stiff because of the cold weather. Do you see more people coming in that they're just, I mean, is it much more advantageous to live in a warmer climate or to keep your house a little bit warmer? Or?
Well, I just have my
But when you go outside, you need to, just probably layer more.
My son and my daughter-in-law, my 4 grandkids just came up from Fort Lauderdale, and so they just came up Christmas Eve. And so I don't think they're going to come back up here. They're going to stay down there after this cold front. Although they did want to see the snow. They really enjoy the snow because she's from Detroit. And so as far as cold weather, and according to Chinese medicine, some people do better in cold and some people do worse in cold. And the same thing with hot weather.
Oh, really?
So according to Chinese medicine, I'm also, by the way, I've been doing acupuncture for about 25 years.
Oh, okay.
So according to Chinese medicine, so some people are better in cold, some people are more, so it all depends. But yeah, basically cold weather, it gets stiff and tight just because you shiver up, you tighten up, but it's also vascular. Okay, if you have especially in extremities, if you get those cold, sometimes people that have not as good circulatory veins and arteries that don't work as well as they should, that doesn't allow the joints and muscles to work as well. So yeah, you can have problems in cold weather just because of the coldness.
Absolutely. What factor does posture play?
Posture is huge because what happens is that if you have good posture, like if I'm sitting this all day long.
Right. If you're sitting like over, bent over.
So when you
right.
have good posture, you have to open up the cavity, the lung cavity, the abdominal cavity. Okay. But if you slouched over, it compresses all those organs in those cavities. Okay. So by posture, having good posture, muscles work better. The organs in those cavities also work better because they're not slouched over. So basically, it's very, very important to have good posture, along with how the muscles work, but also about how these internal organs work.
So when you walk, you really shouldn't be slouching as much, or walking forward, or bending.
Part of our whole therapy is to try to get people, first of all, to get the joints working properly, and then to get them in better posture. Better posture is basically there's a few muscles that in your back that can help you to obtain better posture. By adjusting the joints, especially in the upper back and around the pelvis, by adjusting those joints to get them into working properly, and then by strengthening some muscles in the back and stretching some muscles in the front, you can obtain a lot better posture. The other thing is when you have lower back dysfunction, that can adjust how you hold your head, and over time that can cause a person to become more and more slouched over. And by
because your head is going forward, your whole body will follow.
It's the riding reflex. When you start getting fixations in the mid back, that causes you to bend over like this, which causes you like this, which then you have to have a riding reflex up like this. When you do that, then you start getting worse and worse posture. So by adjusting, getting the spinal joints working properly, again, going back to the biomechanics of the spine, and by balancing out the front and back muscles, strengthening the back muscles, stretching the front muscles, then you can get a lot better posture by just doing a few small things. Okay. And getting back to the neuropathy, I found is that what I found is that that's actually pain, tingling in the feet. Okay, either from diabetes, or from cancer treatment, or just
sometimes severe edema can cause it too. Right.
Being unhealthy over a long period of time. These again, the joints, the nerves, and the arteries in those lower extremities don't work properly as well as they should do. And so by getting them detoxified, and then we have laser and using some ultrasound, and by using also some acupuncture, those can help to promote increased blood flow and decrease the inflammation in the area. But by detoxifying the system, you decrease a lot of the inflammatory process, which is causing inflammatory process over a long period of time causes chronic disease. So if you have a chronic low-grade inflammation over a long period of time, it's going to cause chronic diseases such as neuropathy, arthritis, diabetes, cholesterol, high cholesterol. So all these things, again, goes back to what you eat and how you live, how you exercise.
Well, I thank you so much, Dr. Frederic, for coming on the program.
Are we done already?
We are just about done. And I think you've brought out a lot of good points that a lot of people can follow. And even on a cold day here in Highland Park. And while I just have a moment, I just wanted to thank my crew and Highland Park senior producers for allowing me to do this program and being there for us, for director and crew, and to wish everybody a happy, healthy new year.
Yes.
And to follow the chiropractic suggestions of Dr. Frederic. So you may, if you could leave us one thing, what would you say that we should be doing?
I would say eating better and exercising.
For the new year?
Yes.
Okay. And how often should we be exercising?
As much as you can. I mean, everybody's different again.
Right.
But at least, well, depending upon if you're a healthy, regular, natural, healthy person, anywhere from 3 to 5 times a week.
Mm-hmm. Now, what should they be? A half hour, or if you can do like 20 minutes and then do another 20 minutes in the evening.
That's great. It's just whatever you can do. You start wherever you can do, and you don't mind like if you can't do anything to a certain. You just got to build. You got to take that first step. The most important thing is I find that some patients is they're afraid. Sometimes they want to go to the gym. You don't have to go to the gym. You can do things in your own house. You just do a little, starting with certain exercises, little bending back with your legs, using your leg muscles more and more, and then working into more.
Very great.
Yes.
Great. Good. How about working out with weights? Yeah.
That's great.
Oh,
all those things. It's just where you are, and it's how you can start. You guys just start.
Just start somewhere.
Yes.
Well, thank you very, very much again for being on the program.